Alright, so we're starting the ankle evaluation. So we're going to start with the past history and the present history. Then we'll inspect for any swelling, discoloration, or deformity. For palpation, so we're going to start with the shaft of tibia and fibula, and we'll palpate this for any fractures. Then we have the lateral and medial malleoli. We'll also palpate this for any fractures. And then the dome and or neck of the talus, also inspect for any fractures. Right over here. And then, so for the soft tissues, start with the deltoid ligaments. So it would be right here, the anterior, mid, and posterior for any sprains. Then the anterior tibiofibular ligament for any sprains. And then the lateral ligaments, so the anterior talofibular, the calcaneofibular, and the posterior talofibular. And then the peroneal tendons, so if we put it into plantar flexion and inversion, you can feel it going up over here. And then next, so we'll do for peroneal tendons, we test for any tendonitis, subluxation. Then for any special test, we'll do the squeeze or referred pain test. We'll squeeze up here to see if there's any pain on the bottom. That's for the tibial or fibular fractures. And then we do the calcaneal bump test. So we'll go also for any tibial fibular fractures. Then for the stress test, we're going to do plantar flexion and inversion. That's to test for the anterior talofibular, the calcaneofibular, and the posterior talofibular. Then we'll go plantar flex eversion, and we'll test that for the deltoid, anterior, mid, and posterior. Then we'll do the anterior jaw test. That test for the anterior talofibular and anterior deltoid, and then the posterior jaw test. So that test for the posterior posterior talofibular. Then we do range of motion. We'll do passively and actively. Right now we're going to do active. So we're going to do ankle dorsiflexion 20 degrees, so point your toes towards me. Ankle plantar flexion. Ankle dorsiflexion 20 degrees, pointing towards yourself. Ankle plantar flexion 50 degrees, pointing towards me. Inversion 5 degrees, so pointing inwards. And eversion 5 degrees outwards. Okay. Then we'll do muscular strength test. So we're going to start with plantar flexion. So go ahead and push against me. Push, 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 push. So that tests for the gastrocnemius, tibial nerve, and soleus. Then we'll do dorsiflexion. So push up towards you. Push, 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 push. So that's the tibialis anterior, the deep peroneal nerves. Then we do inversion. So push against me. Push, 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 push. So that tests for the tibialis posterior, tibial nerve, and then eversion. So go ahead and push against me. Push, 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 push. So that tests for the peroneus longus and brevis, or superficial peroneal nerve. Then we do neurological tests. So the motor, we'll do ankle dorsiflexion and inversion. So point it up towards you and then out to the inside. Okay, so that's L4. The L5 toe extension. Extend the toes. And then S1 ankle eversion, so point it that way. And then S1 and S2 ankle plantar flexion, so point it towards me. Then we'll do sensory, so L4 medial side of the foot, L5 dorsum between a web between toes, and then S1 lateral side of the foot. Then we take reflex, so the Achilles tendon reflex, so come up a little bit. Yeah. So basically, we're going to put it into dorsiflexion, and then we'll test for the reflexes. Then we'll do the blood flow test, so to do the dorsal pedal artery test. We'll take the pulse. And then we count for 15 seconds and multiply it by 4. Then we do a recapillarization test. So we press down on the nail bed, and then the blood should come up less than 2 seconds if they have any painted toenails, you can do it on the other side of the under the foot, and it should come up less than 2 seconds. And then we compare bilaterally.